Hello, good afternoon everyone. On behalf of Dentium, I warmly welcome you all in today's webinar on Implants Made Easy, a beginner's guide. So this webinar will be very informative and beneficial for those who are planning to start the implant practices and our new sales team personals also to know our implant system in a better way. And we are very privileged to have Dr. Avantika Tripathi here, MDS Oral Maxillofacial Surgery and Dentium KOL, as our esteemed speaker. She will bringing expert technical knowledge and practical insights on the use of Dentium SuperLine implant system. So thank you all for joining us. Now over to Dr. Avantika.
Thank you, Mr. Subaru. Good afternoon, everyone. Today, we are going to simplify implantology and make it practical, especially for beginners. So, my goal in the next 15 minutes is not to overload you with theory, but to give you a very clear understanding of basic implantology so that you can definitely and confidently start your implant journey using the Dentium SuperLine implant. So I would like to start with the question, are implants really difficult? So many clinicians feel that the implants are complex and technique sensitive, but in reality, implants are not difficult. They are systematic. So if we follow the right protocol and we use a reliable system, implant placement becomes predictable and safe. So today in this session, we are going to discuss what is an implant and how we can place an implant safely and precisely. So starting with the definition of implant, what is an implant? It is an artificial root that is surgically inserted into the jawbone that can be used as a platform for prosthesis. Basically, there are four components of an implant: a crown, an abutment screw, an abutment, and a fixture. A crown is seated over the abutment on the top, which helps in chewing food. Fixture is the portion which is inserted inside the bone. Abutment is seated over the fixture, which acts as a platform for placement of a crown. This is the abutment screw, which is used to hold the abutment with the fixture. Now, why we should use Dentium SuperLine as our initial system. So I'm going to discuss the main characteristic features of Dentium SuperLine. First, it should be used because of its double-threaded design. Now, what this double-threaded design do is it helps us in placing our implant really fast, and this double-threaded design nicely binds with the bone, which allows us to get more primary stability in minimum amount of bone. It has a tapered body design, which again helps in improving the primary stability. It has an SLA surface treatment. SLA is sandblasting with large grits and acid etching. Now, this type of surface treatment helps in improving the process of osseointegration. So, this process becomes really fast so that we can load the implant early. Next is the internal hexagonal connection. Now, internal hexagonal connection allows the abutment to fit over the fixture in a very, very stable form, which allows a very, very stable prosthetic connection. Self-tapping cutting edges. So, these are the cutting edges which is running on the entire surface of the fixture, this diagonal line. So what is it doing? It is allowing easier placement of implant. Whenever we are going to insert the implant, whatever pressure is being created, it is released through these cutting edges. Next is platform switching concept. This is helping in soft tissue preservation. Color coded surgical kit. This kit has a specific color coding for specific diameters of implant. Suppose 5 mm diameter implant is red color coded. So that is made basically to simplify the surgical workflow, to make it easy for us to understand the surgical kit. Optimized thread pitch. What is in pitch? A pitch is the distance between two threads. So it is optimum enough to provide that much of surface area for the bone to nicely adhere to it and provide good amount of osseointegration. high initial stability even in the soft bone. So even if the bone is very, very soft, or in immediate implant cases, in minimum amount of bone, it is going to provide good amount of primary stability. Prosthetic versatility, this system has multiple abutment options, so there is no problem in giving any type of prosthetic prosthesis to the patient. Understanding the parts of a fixture, this, if we are using any type of a fixture, there will always be a platform diameter, there will always be a body diameter of that fixture. This is the total length of the fixture that is going to go inside the bone. There is a bevel on top of it which is smooth, which is not treated. So this is the total bevel height. This is the thread depth, the outer surface of the fixture and the outer surface of the thread. The distance between the outer surface of the thread and the outer surface of fixture is called as thread depth. More thread depth, more surface area for the bone to adhere to it, so more chances of osseointegration. Now the diameters available in this system are starting from 3.6, 4, 4.5, 5, 6 and 7. The length available is 7, 8, 10, 12 and 14. As I was telling about the color coding, so there is specific color coding. 3.6 is coded with yellow, 4 mm diameter is coded with green, 4.5 is coded with blue, 5 mm, orange is 6 mm implant and violet is 7 mm. The diameter of all these fixtures is same, that is 3.33. So the abutment interface, which means that the portion of the abutment which is going inside the internal surface of the fixture will always be a standard diameter, that is 3.33. So any diameter of an abutment can be seated on any diameter of implant, as the internal diameter of all the fixtures is same. Surface treatment, what is the advantage of surface treatment? In this system, the surface treatment is SLA, sandblasting with lacerates and acid etching. So basically what is it doing? It is increasing the chances of osseointegration by increasing the stability of the implant, so that we can load it at a shortened time. Next, a very good advantage of the system is platform switching. So what is a platform switching? It is a loading method basically, where the upper diameter of the implant is smaller than the diameter of the abutment at the connection point between the implant and the abutment. So this much amount of space is being left, as the abutment's outer diameter is starting slightly from the inner surface of the fixture. So it is designed like that to allow some space for the soft tissue to attach. So it is going to provide very good soft tissue attachment. So we will not see those black triangles if the implant is being planned very, very nicely. So the most important thing for beginners is case selection. If you are going to start your implant placement journey, then you should be able to select your cases wisely. Always start with posterior mandible case, as you will have good amount of bone in there. It is not an aesthetic area. So even if you are slightly incorrect, everything can be managed. The bone quality should be D2 and D3. As in the posterior mandible, you will see D2 type of bone mainly. So the bone quality will also be suitable for initial implant placement. There will be adequate bone width, so you will not be requiring any type of bone grafting procedure. So, beginners, in the beginner's case checklist, there should always be good amount of bone. There should not be any infection, and there should be enough space for the placement of implant. Space in all aspects, buccolingual as well as mesiodistal. So first of all, we need to diagnose the case and plan it nicely. So whenever a patient is coming to me with any ailing tooth or a tooth with or a edentulous space, I will examine the patient. I am going to assess the surrounding teeth. I'm going to see the opposing tooth. I'm going to assess the interact space. Once everything is assessed, I'm going to get a radiograph done, a simple OPG or a CBCT. If a CBCT is done, we can plan in all the 3 dimensions. Then we are going to select the size. By measuring the amount of bone, we are going to select the implant size, the implant's length as well as diameter. Once the implant is selected, then we will plan the surgical procedure. In the surgical procedure, we should know the proper drilling protocol of the system which we are going to use. So if we are using the Dentium SuperLine system, we need to start with the initial drill of 2.2 mm, then the second guide drill of 2.6 mm, then 3.6, then 4, then 4.5, then 5, and then countersink of 5 mm, and then after that I'm going to place my implant if I want to place an implant of 5 mm diameter. Now, to prevent over preparation of my osteotomy, the drills are manufactured 0.2 mm short of the final diameter of implant. So if I am going to drill with a 3.6 mm drill, so the actual diameter of that 3.6 mm final drill is actually 3.4 mm. So it is designed like that to prevent over preparation of the osteotomy. So we will follow the same sequence, and then we are going to, with proper drilling protocol and with proper irrigation and speed control, we are going to complete the osteotomy, and then we'll come to the third step of implant placement. Now, the drilling protocol has to be followed by taking drills from this surgical kit. So this is the surgical kit of Dentium SuperLine. These are the first guide drills of 2.2 mm diameter. This is the second guide drill of 2.6 mm diameter, and then we are going to use the final drills till the diameter of my implant. So if I'm going to place an implant of 4.5, I'm going to use 2.2, 2.6, 3.6, 4, 4.5, countersink of 4.5, and then I'm going to place my implant. There are 2 length of final drills and initial drills in this kit. One drill has a room for the placement of stopper. Otherwise, in the smaller drills, there is no room for the placement of stopper. So these are little shorter in length. They can be used in patients with reduced mouth opening. The markings on the shorter size drills is 8, 10, 12 and 14. On the longer ones, we have markings till 16 mm. This is the countersink drill, which is used for the coronal preparation of osteotomy. As our implant is tapered, so we need to prepare the platform separately so that my implant can smoothly insert inside the osteotomy. So these are the countersink drills. So the drilling protocol of countersink drill is that there is a white color band on top of it. So if I feel like the bone quality is very good, I'm going to insert, very good means D1 or D2. Then I'm going to insert the entire depth of this countersink. If the bone quality is soft, which means D3 or D4, then I'm going to insert the drill till the bottom of this line. So we have to be very, very sure that my final drill, after that I'm going to use my countersink drill, and then I'm going to place my implant. If I have drilled till 10 mm, my implant will also go till 10 mm. So if I want to submerge my implant, or if I want to place my implant subcrestally, suppose 1 mm subcrestal or 2 mm subcrestal, then if I'm going to place an implant of 10 mm, I need to prepare till 12 mm, and then I can insert my implant of 10 mm, which will place it 2 mm subcrestal inside the bone. After that, we will place the implant. So the implant placement has to be done with the help of the implant drivers. So there is a hex and a black color ring on the neck of it, which helps in easy gripping of the fixture. Once it is gripped, then we are going to seat it over the over the osteotomy. We are going to check whether the orientation, angulation, position, everything is correct or not. If I feel like the direction, orientation, everything is perfect, then I am going to gradually insert it inside the osteotomy. Once it is inserted, then I am going to check whether whatever I planned I was able to achieve or not by screwing a path pin over it. So this can be screwed with our hand itself. This will help us in checking the orientation, angulation of my fixture. After removing the path pin, I am going to open the cover screw and then I am going to seat it over the fixture. So these are the implant drivers. They are available in two lengths. One is short and one is long. In patients of reduced mouth opening, I can use the shorter one. And in areas, suppose in the mandibular interior areas, where sometimes we feel like our handpiece is touching the adjacent teeth and we are unable to reach the desired depth with the short implant drivers or shorter drills, then in those cases, we can use the longer ones. And if the longer ones are also short enough, then we can take the help of this drill extender. It will increase the length of the drill. So these are the these are the ratchet driven implant drivers. They are placed with the ratchet for the slight, if we want to change the orientation of our implant, if we want to place it further inside the osteotomy, remove it, or anything we want to do with the fixture, we can do with the ratchet also. But the initial placement should always be done with the handpiece, not with the ratchet, because the handpiece is going to provide us controlled placement, whereas with the hand-driven drivers, our hand will not be controlled. This is the hex driver, which is used for tightening of the cover screw, healing abutment, impression copings. This is the drill extender to increase the length of the drill. These are parallel pins. There are 4 parallel pins in this kit. The thinner end of the parallel pin's diameter is 2.2 and the thicker end is 2.6. So after the 2.2 mm drill, we are going to insert the 2.2 side of this parallel pin. And we are going to take an X-ray and assess it. If we feel like the orientation is correct, then we will switch to the second guide drill. Otherwise, if the orientation or position is not correct, we are going to correct it with the first guide drill itself. And then once it is corrected, then only we are going to switch to the second guide drill. These are the path pins that we have to screw over the fixture once it is inserted. This is the depth gauge. There are 2 sides of the depth gauge. One is used to check the osteotomy depth and the other end is used to measure the gingival height of the final abutment. So this conical portion is seated over the fixture, and at whichever line the gum is going to lie, that will be the gingival height of the patient. And the thinner end is placed along the wall of the osteotomy to check whether we have reached the desired depth that we planned or not. So if there is minimum amount of bone also, like in this case, then after drilling, after complete placement of implant, still we will be able to achieve a very good primary stability because of the beautiful design of this implant. So what are the key points that we should take care of? The drilling speed. So the drilling speed for osteotomy preparation should be 800 to 1200 rpm. There is a range because there are different types of bone quality. If the bone quality is soft, then we are going to use 800 or 900 rpm. If the bone quality is hard, means D1, D2 type of bone, then we can use the speed of 1100 to 1200 rpm. The torque for implant placement should be 35 Nm, and it can be less than this if it is an immediate implant placement. We are going to use less amount of torque of 15, 20 or 25 Nm. speed for implant placement should not exceed 50 rpm. It can be 10, 15, 20 till 50, but it should not exceed 50 rpm. So the basic tips for beginners is you should always follow the strict, you should always strictly follow the drilling protocol. So whatever drilling protocol the system is allowing, the company has made, you should follow that same drilling protocol, because that is the correct protocol for the placement of implant. The implant is designed according to that. Do not rush into immediate loading. If you feel like you have not achieved good primary stability, then you should not immediately load the implant. The criteria for immediate loading is that the minimum torque achieved should be at least 35 NCM. Then only you should immediately load it. Always begin with simple cases. So if you will start with simple cases, like as I mentioned, in the posterior mandible, then you will gain more confidence. You'll be confident enough to take difficult cases also after successfully finishing these simple cases. So consistency is more important than complexity. Be consistent, keep on doing it. Then after first case, you'll be confident, and after 10 cases, you'll be very, very confident to take up the difficult cases also. Thank you so much for your patience listening. If you have any questions, please let me know.